Now, Ms. Shields, getting back to you and self-employed individuals, like the realtors you represent that often struggle to find affordable health care coverage, what options do realtors have to obtain coverage?
Thank you, Mr. Chairman. My members, when we were offering our health care plan, they had some options available, obviously. They had the ACA. They did have our plan at the time that they no longer have. Many of them that were married were able to obtain through their spouse. And then, frankly, we have 15% nationwide that are not insured at all. So that is our biggest concern. What we did find was that when we offered our plan, they were comparing our plan to the ACA. So some did stay in the ACA. The ones that we attracted were the ones that the ACA was just too expensive for them. They could not afford it. So we were able to save them some cost. They also found our deductibles were a little better, and so they made the change for that particular reason. And again, back to the spouses, they were able to save money sometimes because they were having to pay for their spouse that might not have been insured as well.
So why are AHPs so important for self-employed individuals like realtors?
Thank you again for that question. It's so important because for many reasons, and I could talk to you all day about it, but the ones I would highlight is, again, the deductible savings. Many cases, we are able to keep them with the doctors they're already using. We do take pre-existing conditions, and it just gives them good, high-quality coverage. We are a plan that was ACA compliant. We had all 10 of the key essential programs that is required by ACA. So we were offering them good coverage.
Yeah, and I can't understand why anybody would object to that. Ms. Strauss, small employers with fewer than 50 employees are not required to offer health coverage to their employees, but many choose to do so. Can you discuss the reasons why small employers choose to offer health coverage?
Yes, that's a great question and one that I get a lot. It's because they want to take care of their people. They want to take care of their communities. They want to be also competitive to the large employers that are out there. Right now, they pay twice as much as a large employer does for healthcare costs. However, they are employing the people that they see at church on Sundays, that they see on the soccer field, and so these are not just employees to them, they are their community. And so they want to make sure that they have that opportunity to provide benefits. And just as mentioned, you know, the ACA in Iowa specifically limits the access to network. So we only have HMO options within our marketplace in Iowa, which is like most states. So in order to offer a group plan, you have more flexibility and you can offer more of those national PPO networks that then have that broader network. So people are not losing their coverage.
And you know, there was a promise made in the ACA that your premiums would go down. And what we've done is employer-based health insurance has become so expensive, it's actually driving people to Medicaid, which is, you know, the problem we have with the mandatory spending issue. So if we can customize it, make it more affordable, obviously, we can get these people on great plans, and obviously the company has and the impact of this coverage, I mean, it's got to be positive. In other words, the idea is it's coming from the employer and not from the federal government. Would that be yeah?
Absolutely, yeah.
Your written testimony, and I've got about a minute, notes how innovative coverage models such as direct contracts and direct primary care allow businesses to lower cost and improve quality. What barriers do small employers face in using these innovative models, and what can Congress do to make it easier for small employers to use these models?
Yeah, so currently when you use direct primary care, there's a subscription or a membership fee that's included for access for those plans, and they are not HSA qualified. So if you have an FSA plan in or an HSA plan in, you don't receive those tax benefits on those plans. Direct primary care also has a huge impact on outcome of health care. So typically those employees that are using direct primary care have a much higher level of direct access to their provider. And so in the case of maybe diagnosing a chronic disease earlier, those things are going to be caught. So there's a lot more advocacy on that side of things. So that for me, is a big piece of it is just making sure that those employees and employers can afford to offer those direct primary care options.
Great, thank you so much, and I'll yield my time now.